It's been a fantastic day, but it would be an opportunity missed if we didn't take the opportunity to formally invite our new Chief Executive to the stage, although not so new anymore. Can I introduce Len Richards? Please give him a warm welcome.
Thank you, Ruth, and thank you to everyone here. It's been a fantastic conference. I've really enjoyed the afternoon that I've spent here. I'd like to reinforce some of what we've heard this afternoon, the importance of laughter. I think the job of a nurse is a very busy one. It's quite intensive. The interaction that you give with the patients takes a little bit of yourself every time, and I think we recognise that in leadership. And I'd just like to add to something that Adrian said earlier. You're all leaders in your own particular way, and I think it's really important for us to recognise that within the organisation. I'd just like to say as well that, so my daughter is a Band 6. She works in forensic mental health in Manchester. But I've got to say as well, she's the funniest person I know, and she makes me laugh every time I speak to her. And I know that that's a mechanism that she uses to actually be able to manage some of the day-to-day stresses that there are within the working week for her. So I was going to start with something that I thought might make you laugh, although I feel a little bit intimidated sat opposite. And we're going to talk about flu later on, but I was talking to a nurse on Wednesday at one of our sessions. We call it the big room. And she'll remain nameless. I don't think she is here today, so if you keep this quiet, then she'll never know that I've been talking about it. I told her that I was coming here today, and I said that I'd make sure that I had my flu jab today, and just as a way of getting a picture of that and trying to promote that throughout the organisation. And she was really pleased that I was prepared to do that and really quite supportive. About 5 minutes later, she sidled up to me in the meeting and she whispered in my ear, she said, wear a short sleeve shirt. She says, we can't have you taking your shirt off. Shattered the dreams of a middle-aged man, I guess. So what I'd like to do is, I've been here about 3.5 months, and what I'd like to do is maybe just talk to you about some of the things that I've done since I've been here and where I've been. So I've been on television twice. I've been at a public accounts committee once, and they're quite stressful occasions, and a lot of what I heard this afternoon would have been great if I'd heard them probably 3 months ago, so I could have prepared for those things. And I suspect that there'll be more of that with a big organisation that we have here in Cardiff and the Vale. But the more exciting part of my job is when I get out and about and I meet people like you on the coalface all of the time. And I'm really enjoying the work that I've been doing over the last few months. So I've visited sites across Cardiff and Vale. I've been to all the major sites. I've been to a number of GP practices, and I've been out in primary care to listen to the leaders of the primary care teams and what they do on a day-to-day basis. I did a night shift with Unison with Mike Jones on the UHW site. So we visited every ward and department on UHW overnight because often the messages or the discussions that we have within an organisation are often during the day in normal working hours, and people who do work nights actually miss out on those things. So that's a great example of engagement with staff, and that's something that I want to do on the UHL site and other sites, working alongside our union colleagues. I've been to a celebration event in medicine, and I think we celebrate well here within Cardiff and Vale, and just the last session is a good example of that. And I've seen on the YouTube the actual the film of the last awards ceremonies as well, and I think we do that really, really well. I spent some time with Lorraine Spate in cystic fibrosis unit, and we walked around the facility and she talked through all of the plans that she has for the development of that unit and to make that a unit that is more responsive to those patients and will tailor the transfer of patients out of childhood into adulthood. A great event within Clandock around surgery, where we met with all of the staff from theatres, and this was the Surgical Clinical Service Board that wanted just to listen to the nursing staff and what they wanted, what they needed to be able to provide their services more effectively, and I was able to take part in that. And I went to some safety visits at Yoreth Jones, Hafan Coed, and the upper GI unit on A1 Link. When I was on the upper GI unit, I met one of the ward managers, Christine Baber, and I've got to say that was one of the best. It's something that stuck in my mind, and it stuck in my mind for two reasons. One of the reasons was the enthusiasm that she displayed for managing that particular ward. But more than that, she had to leave us for a few minutes while she was tending to a patient. And one of the members of staff actually came up to us unsolicited and just said, "I love working on this ward. This is the best team I've worked in. I really enjoy it." And for someone to do that, I think is testament to the leadership that is provided by our ward managers every day. I talked earlier about one of the award ceremonies I've been to, and you see inspirational things. We've seen that today here just in the last session. But Jacqueline Duke is an unregistered nurse, I understand. She set up a dementia room on ward A7 at UHW, and she did that of her own initiative, and she won an award within medicine. And again, just another example within Cardiff and the Vale of staff who were prepared to go that extra mile. I've also met with Suzanne, and Suzanne took me around the maternity unit and talked me through all of the services that we provide. But again, during that visit, I managed to speak to the consultant, midwife consultant for Normality. And she talked to me about the surveys that she's doing with women to find out what it is they expect and want out of a maternity service, and then look to see how we can mould or change the way in which we provide services so that we better meet the needs and expectations of women. And again, just a great example of the willingness to provide services that are more in tune with what patients want. And then just earlier this week, I was able to work with Adele Watkins, or be with Adele Watkins. She'd done an awareness session at the Children's Hospital about mental health awareness within childhood, but also signing the pledge for a time to change, a time to remove the stigma from mental health services. And again, going above and beyond the call in actually providing that awareness session and engaging with the staff in the Children's Hospital. So these are all great examples of where people go above and beyond, and I think it's something that I've certainly noticed in my time around the organisation. So my reflections of the first 3.5 months here is that the nursing staff here are very passionate, and this comes over time after time, and that's why I like to go out and meet staff at the front line, because you actually feel that, and it's a very tangible feeling. There's no doubt that people are focused on the patient. And as a chief executive, that's what I need to know. I need to know that people at the front line are really engaged with what patients want and how they're providing services. I don't have to say it here, but we have some real high achievers. And we've seen that again today, but I see that in all of the awards ceremonies that we have. And I think you're a real credit to the profession of nursing and midwifery, and you're also a real credit to the organisation. So my message to you is that you should be proud, and I'd like you all just to give yourselves a big round of applause for the work that you do. Thank you. So now on to two business issues, two things that I just wanted to talk to you or take this opportunity to talk to you about. We've launched our consultation, which is called Let's Talk Travel. We know we have to look at this. We know that we moved to free parking on the UHW site on the 5th of June, but we also know that we have to manage the parking on that site and manage the congestion that could arise. Now, one of the things that I would promote, I use the Park and Ride service. I think it's really good. And I was on the Park and Ride on Monday. And one of the things that it was really full. The bus was really full, which is a good sign for me. But having said that, what we need to do is create bigger buses, double-decker buses, that sort of thing. Because I do think the Park and Ride is one way of managing sustainable travel for the site. But what I would ask you to do is take part in the Let's Talk Travel consultation, because you need to tell us how we should organise those services so they best meet the needs of nursing staff. You're the biggest staff group that we have within the organisation. Park and Ride is not just for nurses, but if we get a steer from you as to how to make it more accessible, how to make it more convenient, that will help us design that facility going forward. And then the other issue that I just wanted to raise was around the flu. We're approaching flu season, and last year we achieved 50% of staff to have their flu vaccinations. This year we're setting our sights much higher than that. What we want is to achieve over 60% of our staff to have the flu vaccination. And I understand from today there's been over 170 of our staff vaccinated during the day, and that's a great credit to the staff who've been, the occupational health staff who've been providing that, and a great credit to you for coming forward with that. But what we want to do is really introduce an incentive into the system this year. So we've allocated 50,000 of capital money to be used in an incentive for those clinical service boards that do the best. So this is a call to arms, really, a challenge for you out there within your clinical service boards. So what we want to do is give 30,000 to the clinical service board that achieves the highest percentage of staff who've had their flu jabs. They have to get above 60% because that's the level that we're pitching at, but the clinical service board that gets the most, then they will get a prize of £30,000 to be spent on something within their particular areas. And I would like the flu champions to be the people who choose what to spend that money on. So rather than leave it to management, leave it to the people who've actually worked hard to be able to provide those services. The second thing is that there's a second prize, which is 20,000 for the clinical service board that has made the greatest improvement from the figures of last year. So we know what the percentages were within the different clinical service boards, and therefore there'll be 30,000 for the highest percentage, and there'll be a further 20,000 for the clinical service board that has made the most improvement. Okay, I'd like to just thank you. I'd like to say thank you very much for the services that you provide. I'd like to say thank you very much for today. I'd like to also thank Ruth and her team for the hard work that it takes to put a conference like this in place. And I'd like to, if you just bring that up, I'd like to just give Ruth these flowers as a sign of thanks from me as the Chief Executive, but from you as nursing staff.